You're watching Access Minnesota. Here's Jim Dubois.
And now more of our conversation with MNsure's Executive Director, April Todd-Malmlov. Tell us about the people who are signing up for MNsure so far. What do we know about them?
Well, what we know about them is many of them are coming on and they are shopping. They are looking to see what their options are. We have over 40,000 people that have come to the site that are looking to see what their options are. Of that, we've got about 31,000 people that have gone through and completed an application, and about 11,000 of them have enrolled in coverage. And we know that they are enrolling in private coverage. They are qualifying for Minnesota Care and medical assistance. They represent a wide swath of age groups all across the state. And so we have a wide interest.
There have been some concerns expressed that if young people do not sign up in sufficient numbers, young and healthy people, that could cause the overall cost of policies to increase. Any concerns about that? And what trends are you seeing so far with regard to younger people signing up for MNsure?
Well, I think that has historically been an issue, and it's nothing new today, as opposed to what has historically occurred in the past. So it's nothing that's a new problem. I think what the ACA really has done through a variety of mechanisms is encourage young people to get coverage. One of those that went into effect pretty early on was that young adults up to the age of 26 could stay on their parents' policies. And we do know from surveys that we've done that many more of those young adults are getting coverage because they're able to stay on their parents' policies. So the ACA has done a good job with that. The other components of the law that also encourage young adults to get in is the subsidies. Many of them are at income levels that would qualify for the tax credits. And also the individual mandate as well, encouraging people to get coverage, or they would pay a penalty for not doing so. So there's a lot of sticks and a lot of carrots that are included in there to really encourage young adults to get coverage. We also know that through research that most young adults want coverage. They know they need it, but it really is an affordability issue.
So when it comes to marketing MNsure, if that's a tougher nut to crack, the younger healthcare consumer, I suppose for a lot of them there's a sense of immortality that might make it seem they don't need health insurance at this point. But how do you tailor a marketing message to get those younger people to realize that it's important to have health insurance? I
think what our marketing message has done is exactly hit that population. Our marketing campaign that we have gone out with is a bit unusual. The key goal was to be very Minnesotan. Also to be humorous and to grab attention, because I think most people, like to TiVo through their commercials. They don't want to watch commercials anymore. So we really wanted to grab attention and do that in a funny, humorous, but actually very serious way, where we're highlighting in many ways where Paul Bunyan just gets hurt and shows the 10,000 reasons that you actually need health insurance. And we've gotten some very positive response on that campaign. It's gone viral in many instances, and so we're very excited about that campaign and think it's doing a good job.
For someone who has never had health insurance before, and perhaps they're taking a look at the MNsure website for the first time, what can they expect to encounter, and what advice would you give to them to help them navigate through what could be a very confusing process?
Well, one of the things that MNsure is designed to do is make it easier for people. So one of the things is they'll be able to go on and see what types of health insurance coverage are available to them by their age and their geography. They're classified in 4 categories. So to make it a little simpler, they can look at 4 different categories instead of each plan individually. They can also see what the prices are, what they would have to pay if they go to the doctor. And so what we really encourage people to do is take some time, go in there and look at the information. It's in there in an apples to apples way, so that it is easier to compare. And many people that we've heard from, especially one of our people that have enrolled yesterday, that was at our board meeting, really said, it took us about a half hour. And it was much easier than I thought it was going to be. And I was scared to do it, but once I got on, it was really easy, and she would encourage others to go on.
Now, for someone who has had health care in the past and may have health care insurance now, what differences will they encounter when they go shopping on MNsure?
Well, hopefully what they will find is new options, more comprehensive coverage, and more affordable coverage. And many of them would probably qualify for discounts as well.
Given the glitches that have accompanied the national ACA website, do you see any carryover into Minnesota? Do you think people may be more reticent to go to MNsure's site fearing that they may encounter some of the same issues?
We hope that that's not the case, and we are doing as much as we can to help explain to people the differences that do exist. So there are two components of the federal system. One of them is the federal exchange, and that's the one that has gotten a lot of discussion nationally. Minnesota's exchange has no interaction with the federal exchange at all. The second federal system is called the Federal Data Services Hub, and that is a system we do have an interaction with. That is the system that is used to verify eligibility for whether or not people qualify for discounts, for example. And we use that service, and that service has generally been working very well, and there have been few issues with that service.
For people who may be signing on to MNsure for the first time or are thinking about doing it or perhaps are putting off doing it, what are some important deadlines that they should keep in mind?
So there are a couple of important deadlines. The first one is December 15th. So if people want to have coverage that is effective on January 1st, they need to apply and pay their premium by December 15th. So that's one key date. Another key date that is just for this year, because the open enrollment period is for a 6-month period of time, just this first year, is that people can enroll this year by the end of March. So by March 31st, you would need to come in to have coverage for this year and avoid the penalty that would be assessed for not having coverage. So people do have a 6-month period of time. Next year, it goes down to a 3-month period of time where it is October through December. But for this year, December 15th or March 31st.
President Obama promised Americans that they could keep their own doctor or their own health care plan if they so chose. That's not happening in some cases. Is this much of an issue in Minnesota, and what do you think about that?
Well, really, MNsure isn't involved in that. That's a different component piece of the ACA. Our regulatory partners at the Departments of Commerce and Health really regulate that. But one key component of the ACA is how states implement it. So in Minnesota, we have pretty strong regulatory provisions and consumer protections in Minnesota that our regulatory partners are essentially interpreting to mean that that the carriers can't cancel their policies. They will change them to comply with the ACA, but people wouldn't be getting cancellation notices. They'd be getting notices around, this is how your coverage is changing to be compliant with the federal law. Other states may be interpreting that differently.
If someone by chance does not have computer access, are there other alternatives to sign up for MNsure?
Absolutely. So they can always come on the website. They can go to a public library to go onto the website and get coverage. But they can also call our call center. Our call center is open that can help people. They can also go to one of the many boots on the ground that we have that are called assisters. And this includes community organizations, agents and brokers that are located all across the state that are affiliated with us that can help people on a one-on-one basis.
If someone wants to check out MNsure, can they simply create an account, shop around, but not necessarily make a decision with that particular session on MNsure?
Absolutely, and they don't even have to create an account. People can just go to our website and shop if they want to. They don't have to enter any personal information or create an account at all if they just want to shop. Once they have a better idea of what it is that they may want, then they can come in and create an account, see what they might be eligible for, and continue to just keep shopping as they may want to. So they definitely have the ability to do that.
April Todd-Malmlov is the Executive Director of MNsure. April, thank you so much for joining us on Access Minnesota.
Thank you for having me.
The broken, bug-riddled government healthcare website has driven down public support for Obamacare. When Access Minnesota returns, U of M political science professor Larry Jacobs discusses the polling numbers and their potential impact on the 2014 elections.
Access Minnesota will return after these messages.